A couple of months ago, we showed you a new set of e-cards. They're used to anonymously tell someone they might have been exposed to a sexually transmitted disease. The site was created because it is tough to talk about the topic with your partner. In today's Just Ask, we're talking about how to approach a topic like that and what you're at risk for. It's one of a series of topics related that we will cover over the next few months in our Just Ask segment. Dr. Robin Hubbard with Grand Rapids Women's Health joins us to answer your questions. And first of all, why do you think it is so hard to talk about that with your partner?
Gosh, it's the most intimate thing that we do, and while we might feel comfortable being intimate in the privacy of the bedroom, actually sitting down and talking about it comes on a whole different level. And I think that especially today in our culture where more and more people communicate by technology and less by face, sitting down and looking at a partner and saying, do you have an STD, or are you carrying a condom with you, and should we have safe sex, is really awkward and intimidating. And
I think there can be a little bit of a fear. Like if you bring it up and somebody thinks that you're bringing it up in a way that you're accusing them, then they could leave, not come back, and so you're like, well,
right,
you know, maybe just this one time. But one time is all that it takes. What are some of the things that you are exposed to when you do have unprotected sex?
Gosh, there's so many different risks. I think the first thing to think about is that you need to be responsible for your own safety. So you can't put that into the hands of anyone else. So when you think about that, you're being exposed to any of a number of sexually transmitted infections potentially, which could be acute, like chlamydia, where you cannot have any symptoms 70% of the time, and it can go on to cause infertility or pain problems. Something like herpes, a partner may have gotten 15 or 20 years ago and still carry it and be able to pass it on to you, and then you have a lifetime of potentially painful sores, or human papillomavirus, which can lead to cervical cancer.
And all other kinds of cancer. We're finding it's linked to oral cancer now,
yes,
so we can put that two and two together, right? The thing about herpes is that sometimes people have outbreaks. Sometimes they'll have one major outbreak when they first get the virus, and they may then just harbor it for the rest of the time. And so what is this? There may be a misconception that people are over it then. You're never over it.
Right. Viruses act that way. They live in nerve roots and they become dormant. They sleep there and they might be silent for years and years, and then something triggers it. So herpes, you could pick up the very first time you have sex, and then you could go on and be in middle age and maybe divorced in a new relationship and whammo, have symptoms, and it doesn't necessarily mean it's from that partner that you're with now. It could have been from years ago.
I'm glad we could touch on some of these topics, especially letting people know that they can carry these with them for the rest of their life, and they may not turn up till they're in their late 40s, early 50s, maybe even 60s, and so you need to really be careful.
I have a lot of patients who are in their late 20s or 30s or 40s who look back on their maybe late teens, early 20s with regret about the choices that they made and the fact that they didn't use condoms, that they maybe were indiscriminate about the number of partners they were with, and now they're living with the consequences.
Could have been prevented. All right, thanks for reminding us that, Robin. And you can find out more on this story and all the stories you saw on today's show by going to WCZM13.com. Just click on Healthy You.